We usually sit there and we wait for the phone call, and then we go and we look after people. And there's been many times where I've thought, if I could only have talked to these people or helped them out last week, this wouldn't have happened. And now we're seeing it, and it's brilliant.
Community paramedicine came about as a kind of a joint agreement between us and the health authorities to help move paramedicine away from just the emerge setting into more of a preventative setting.
The purpose of the program is to help supplement healthcare services within rural, small rural and remote communities, and so that's where the focus has been for the program up to date.
A regional training officer for the community paramedics. Our job is to support the community paramedics.
We've been kind of getting the community paramedics trained and ready to go out into their respective communities.
We're rolling it out across the province. We have 80 full-time equivalents across 73 communities, and just the scope and the magnitude of how we're doing it is completely different than anywhere else. Community paramedicine is a proactive approach to helping patients support themselves in a safe and healthy way in their own homes.
I find a lot of our elders, and of course we're working a lot with our First Nations as well, they trust you.
People that are maybe stuck in their home that don't have the mobility that they used to. These patients aren't calling 911 as often anymore because we're going in to see them on a preventative type basis.
One lady wasn't swallowing her pills because she would choke, and she was afraid, so she wouldn't. And of course nobody knew this because she wouldn't tell anybody. And it wasn't until I'm sitting in her living room and we're, petting her little puppy and talking to her that this all came out.
Just when you can go into the house and, thanks for coming, you're the only visitor I've had all day, and sometimes it's all they really need.
I would much, much rather go visit someone and help them rather than go and do that code 3 call.
Looking at why we all got into emergency services and into the ambulance service in particular to help people. And if it does turn into an emergency, you're still there in that capacity like you always have been.